If you're taking tirzepatide or considering it for weight loss, one of the most important questions you need answered is, how long does this medication actually stay in your system? Understanding this isn't just about curiosity. It affects your dosing schedule, what to expect if you miss a dose, how long side effects might last, and what happens if you decide to stop treatment. I'm here at ThinWorks in Palm Beach Gardens, and today I'm breaking down everything you need to know about tirzepatide's half-life, how long it stays in your body, and what this means for your weight loss journey. This is critical information that every tirzepatide patient should understand. Let's start with the science, because understanding how tirzepatide works in your body will help everything else make sense. Tirzepatide is a dual GIP and GLP-1 receptor agonist. That's a mouthful, but what it means is that it mimics two natural hormones in your body that regulate appetite, blood sugar, and metabolism.
It's the active ingredient in medications like Mounjaro and Zepbound.
And it's showing absolutely incredible weight loss results. We're talking about 15 to 20% body weight reduction in clinical studies. But here's what makes tirzepatide unique from a pharmacological standpoint. It has a very long half-life. The half-life of a medication is the time it takes for half of the drug to be eliminated from your body. For tirzepatide, that half-life is approximately 5 days, or about 120 hours. Now you might be thinking, okay, so it's out of my system in 5 days, right? Not quite. This is where it gets a little more complex, but stay with me because this is important. When we talk about how long a drug stays in your system, we're really talking about how long it takes for the medication to be completely eliminated. The general rule in pharmacology is that it takes about 5 half-lives for a drug to be essentially cleared from your body. So for tirzepatide, with its 5-day half-life, we're looking at approximately 25 days, or about 3 to 4 weeks, for the medication to be fully eliminated from your system. Let me break down what this looks like in real time. Let's say you take a dose of tirzepatide today. After 5 days, about half of that dose is still in your system. After 10 days, about 25% remains. After 15 days, about 12.5% is left, and after 20 days, about 6.25% is still there. And after 25 days, less than 3% remains, which is considered negligible. This long half-life is actually one of the reasons tirzepatide is so effective for weight loss. Because it stays in your system for an extended period, you only need to inject it once a week. The medication maintains steady levels in your bloodstream, providing consistent appetite suppression and metabolic benefits throughout the entire week. Compare this to medications with shorter half-lives that require daily dosing. With those, you get peaks and valleys. Your medication levels spike after each dose and then drop before the next one. With tirzepatide, you get much more stable, consistent levels, which means more consistent results and often fewer side effects. Now let's talk about what this means for your dosing schedule, because this is where understanding half-life becomes really practical. Tirzepatide is administered once weekly, typically on the same day each week. Because of that long half-life, the medication builds up to your steady state levels in your body over the first few weeks of treatment. Steady state means that the amount of medication being eliminated equals the amount being added with each dose. It typically takes about 4 to 5 weeks to reach steady state with tirzepatide. This is why many patients don't see maximum results immediately. Your body needs time to build up therapeutic levels of the medication. This also explains why the dosing protocol for tirzepatide involves gradual increases. Most patients start at 2.5 milligrams once weekly for the first 4 weeks, potentially continue increasing every 4 weeks up to 10 or 15 milligrams depending on tolerance and results. These 4-week intervals aren't random. They're designed to allow your body to reach steady state at each dose level before increasing. This minimizes side effects and helps your body adjust gradually. So what happens if you miss a dose? This is a common question, and the answer depends on how much time has passed. If you remember within 4 days of your scheduled dose, take it as soon as you remember, then resume your regular weekly schedule. Because of tirzepatide's long half-life, you still have significant medication in your system during those first few days. If it's been more than 4 days since your missed dose, skip it and take your next dose on your regularly scheduled day. Don't double up. Taking 2 doses too close together can increase your risk of side effects without providing additional benefits. The long half-life of tirzepatide gives you some flexibility, but consistency is still important for optimal results. Try to take your injection on the same day each week at roughly the same time if possible. Now, let's talk about side effects, because understanding how long tirzepatide stays in your system helps explain why side effects occur and how long they might last. Nausea, sometimes especially in the first few weeks. Diarrhea or constipation, decreased appetite, which is actually the desired effect, abdominal discomfort, and occasional vomiting in some patients. These side effects are most pronounced when you first start tirzepatide or when you increase your dose. Why? Because your body is adjusting to new, higher levels of the medication. As you reach steady state at each dose level, side effects typically improve. If you do experience side effects, here's what you need to know. They usually peak within the first few days after your injection, when medication levels are highest. They typically improve as the weeks go on. They often diminish significantly after the first few weeks as your body adjusts, and they can usually be managed with dietary modifications and proper hydration. At ThinWorks, we work closely with our tirzepatide patients to manage side effects. We provide detailed guidance on eating smaller, more frequent meals, avoiding high-fat and greasy foods, staying well hydrated, and eating slowly and mindfully. These strategies can make a huge difference in your comfort level. But here's an important point. Because tirzepatide has such a long half-life, if you do experience severe side effects, they won't disappear immediately, even if you stop taking the medication. It can take several days to a week for levels to drop enough that side effects significantly improve. This is why starting at a low dose and increasing gradually is so important. Now let's talk about what happens when you stop taking tirzepatide, because this is something many people wonder about. If you discontinue tirzepatide, the medication will gradually leave your system over the course of 3 to 4 weeks. During this time, you'll notice several changes. Your appetite will gradually return to baseline. The appetite suppression that made it easier to eat less will diminish. You may experience increased hunger and food cravings. Your blood sugar levels may rise if you have diabetes or pre-diabetes, or you may even regain some weight if you don't maintain healthy eating habits. This is why tirzepatide is most effective as part of a comprehensive weight loss program that includes nutrition education, lifestyle changes, and ongoing support. At ThinWorks, we don't just give you tirzepatide injections and send you on your way. We provide tools and support you need to maintain your results long-term. Some patients choose to stay on tirzepatide long-term as a maintenance therapy, using a lower dose to help maintain their weight loss. Others use it as a tool to jumpstart their weight loss and then transition to maintaining their results through diet and exercise alone. Both approaches can work, and the right choice depends on your individual situation. Now, let's talk about some important factors that can affect how long tirzepatide stays in your system, because not everyone metabolizes medications at exactly the same rate. Your kidney function plays a role. Tirzepatide is eliminated primarily through protein degradation, but kidney functions can still affect clearance rates. Your liver function matters. Your liver plays a role in metabolizing peptides, so liver health can impact how quickly tirzepatide is processed. Your age can be a factor. Older adults may metabolize medications slightly differently than younger people. Your body weight and composition matter. Larger individuals may have different distribution volumes for the medication, and other medications you're taking can potentially interact and affect metabolism. This is why medical supervision is so important when taking tirzepatide. At ThinWorks, we evaluate your complete medical history, monitor your progress, adjust dosing as needed, and watch for any potential interactions or complications. Let me also address some common questions we get about tirzepatide and drug testing, because this comes up occasionally. Tirzepatide is not a controlled substance and won't show up on a standard drug tests. It's a prescription medication used for legitimate medical purposes. If you're taking tirzepatide under medical supervision, there's no reason to be concerned about drug testing. However, if you're planning surgery or certain medical procedures, you should inform your healthcare provider that you're taking tirzepatide. Some surgeons recommend stopping GLP-1 medications before surgery due to concerns about delayed gastric emptying. Because tirzepatide takes 3 to 4 weeks to fully clear your system, you'll need to plan accordingly. So here's the bottom line on how long tirzepatide stays in your system. The half-life is approximately 5 days. It takes about 25 to 30 days for complete elimination. You reach steady state levels after 4 to 5 weeks of consistent dosing. The long half-life allows for once weekly dosing, and effects on appetite and metabolism persist throughout the week. Understanding this timeline helps you know what to expect when starting tirzepatide, why the dosing schedule is structured the way it is, how to handle missed doses, what to expect with side effects, and what happens if you stop treatment. If you're considering tirzepatide for weight loss, or if you're currently taking it and have questions, we'd love to help. Visit ThinWorks.com to learn more about Tirzepatide weight loss programs in Palm Beach Gardens or call us at 561-235-0100 to schedule your consultation. We offer Tirzepatide injections with complete medical supervision, personalized dosing protocols, ongoing support and monitoring, and comprehensive weight loss guidance to help you achieve and maintain your results. Thanks for watching, and remember, understanding how your medication works is the first step towards getting the best possible results from your weight loss journey.